Gillian Keegan here for the government this morning. Stunning. I can't believe that story.
It's shocking, very unbelievable, and she looks so young as well.
Yeah, it'll develop during the day, that story. We'll find out more about what happened. Here, of course, Minister for Care, but representing the government this morning. Are we going to cut the gap between the second vaccination and the booster?
Well, the JCVI are the only people who can answer that question. So what happens is the JCVI obviously look at all the data. They look at loads of different things, and they basically make trade-offs and sort of advise us. So they've advised us 6 months. We put that plan in place from the 14th of September. First booster jab went in the arm on the 16th of September. And, of course, they continually look at the data, but they're the only people who can really answer this question. But if they advise us, our job then is to get ready, obviously, to do whatever they say. So, but at the moment, it's 6 months. That's what we've been told. And that plan's in place, and it's been in place for about 5 weeks now.
Chairman of the Health Select Committee, Jeremy Hunt, of course, former Health Secretary, he's saying it should be cut to 5 months.
Yeah, well, he's not on the JCVI. I mean, there's a lot of people who have opinions. I mean, we went through this previously, and it's not unknown. The JCVI have changed at periods of time and have reacted. But, you know, we have them in place for a reason, and, you know, we take their advice. So they will be looking every day, all the data, and they will advise us. But at the moment, it's 6 months, and we are fully arming everybody to try and get a booster jab as quickly as possible.
But what about people who've had those 2 vaccinations and then the efficacy of that is waning, and while they're waiting for their next booster, they get COVID?
Well, first of all, there are people who get COVID who have had 2 vaccines. I mean, my parents actually had it the other week. But of course, the vaccination has helped very much with the symptoms, and they said it was like a heavy cold. But we are concerned always to make sure that we keep the vaccine. The vaccine has been the wall of defence. We want to keep that wall of defence, which is why not only are we having this big campaign today, we're telling everybody, young people can now go online as well and book, so they can just walk in and they can book with their GP, etc. So, and there's also 4.7 million people.
So young people can actually go to walk-in centres?
They can go now and book. So the booking system we've all been using, it wasn't there for young people. That's now live from today. So they can go online, they can book a walk-in centre, a GP, all the places that you can go to, the vaccination centres. That's from today. So we've got that ready for half-term. And we'd urge all the young people who haven't yet had their jabs to use half-term to get their jabs. And then we've got 4.7 million people who haven't yet come forward for their first jab, which is why we've got this campaign saying, please come forward. And the boosters are starting to be rolled out. I think we had our biggest booking day on Wednesday this week. I think 234,000 people booked their boosters. So in the next couple of weeks, you'll see many, many, many more people, including those in care homes, having their booster jab. And that's a vital part of our protection.
As we see cases up to 50,000 yesterday, Health Secretary saying it could rise to 100,000 cases a day. Why are you not putting Plan B in place now?
Because what we've got is, we've laid down Plan A and Plan B, and we've just started, as I say, 5 weeks ago, Plan A. The most important thing is to do all the things I've just said. Get that vaccine rolled out, get those boosters rolled out. And of course, we have Plan B there. It is there for a reason. But right now, we're really focusing. We know that the vaccine is the best thing we can do. We're really focusing on making sure that that is rolled out. And, you know, if that should be successful. We've seen this. We've been there before. You know, we've also got antivirals coming. That was another part of the announcement. So that is really the focus, to make sure that
we're not going to reduce the time to 5 months unless the JCVI tell you to.
That's definitely true. And also, you know, when we opened up on the 19th of July, we did that because we'd shown that we'd broken the link between the cases and the deaths. And that's still the case. You know, the cases are high, and obviously we're not complacent about that, but the death rates still are very low.
What's the downside to compulsory mask wearing?
I think there's a downside to many of these things. I mean, you know, some people do find mask wearing difficult. It's a personal choice, but most of us are wearing masks. I mean, on the tube, most of us are wearing masks. I don't know if you've seen that. And I think as more and more it gets into winter, I've had a cough, so I've been wearing a mask. Having a cough is socially unacceptable now. You know, you feel terrible. So I think it is a personal choice. Many people do wear masks, and many people, when you go out into meetings, I was in care homes yesterday, everybody was wearing masks. But it's about personal choice. We're not the sort of country that tells you what you need to wear or, it is about personal choice. We all know the pros and cons of this. We spent 18, 19 months educating ourselves. So we all know what to do. And, it's not for the government really to mandate it. Of course, it's there as a backup and it is there as part of Plan B. But, we expect that people will do the right thing. And actually, most people are doing the right thing. But the right thing you can do right now is come forward for your vaccine or come forward for your booster.
You say most people are wearing masks, but I mean, looking at the images from the House of Commons the other day, I only could see Theresa May wearing a mask on the benches. There you go. I mean, not many people doing the right thing there, are they? And Jacob Rees-Mogg said, you don't need to wear a mask during debates because of the convivial, fraternal spirit within the Conservative Party. Does that mean if you are convivial and fraternal, you don't get COVID?
No, I think, everybody knows that you can get COVID from anybody.
Not setting an example, though, eh?
No, and to be honest, we didn't. Throughout much of the summer, not many of us have had masks on. I mean, I had a mask on yesterday just because, again, I was coughing. But and Theresa May has had one all along because she's also diabetic.
And diabetic.
So I think she, and there's actually a number of people, it's not just Theresa May, a number of people who have health concerns. And if I sit next to anybody who has a mask on, I always put a mask on because obviously they're concerned about themselves. But you'll find more and more as we go into winter, people will be wearing masks. But we shouldn't make it this, this sign of virtue or not. I mean, people have to make sensible choices, but we've been criticised by the Labour Party, who all wore masks in the chamber, but at their conference none of them had a mask on. Even more people in and
I'll be putting that to Labour when I speak to them later on. But don't be hypocritical. But I'm not asking about Labour. I'm asking about the government, and also the fact that in Scotland it's mandatory to wear a mask on public transport and also within shops. It's also the case in Wales, so they're wrong to do that.
I think we've all had, it depends on what you want to say as a government. I mean, we've all had different things from different times with the devolved governments. And we have it in our Plan B. We have it in our Plan B. The very first part of this interview is what we should be talking about. Getting the vaccine, getting the booster.
And we've talked about that.
And the mask is less relevant.
Important, surely.
Well, it is important, and it's actually quite important for flu and for other symptoms as well. As I say, as we get into winter, I think more and more people...
But it's a social responsibility to wear a mask to protect other people.
It's a social responsibility to get the vaccine. That's the most important thing you can do. Get the vaccine, get the booster, and then behave sensibly. Social distancing, the hand washing, the mask. We all have those personal responsibilities. And the British people have been fantastic. They have been really, really responsible. And, I think they are more than capable of making the right choices.
Government's not leading by example. You accept that. I mean, you saw those pictures. Have another quick look at them, Rich, shall we? Just Theresa May looked as though she had her mask on. So,
that's the House of Commons. As I say, I think more people will start to wear masks as we get into winter. I think that will happen. Okay. But, it's not very comfortable sitting there for hours either in a mask. And we know that,
Better than the alternative, right?
Well, that's why we're all... I mean, I'm sure everybody in that picture has been vaccinated, and I'm sure everybody in that picture will have their booster. Yeah,
and to travel, we're told we need to be fully vaccinated. Fully vaccinated, does that mean 3 doses now? Does that mean you can't travel unless you've had your booster?
I don't think so. I think the advice at the moment is the double jabbed vaccination. But of course, that will evolve over time as the third dose comes in. But it would be unreasonable to say right now, when we've only just started the programme, that...
so it's 2 doses for now.
I mean, of course, they're trying to get this balance, but it's two doses for now. But I'm sure as the vaccine passport type of sort of concept will evolve, and there will be, if you've had your booster, etc., because it's not probably going to be good for next summer, for example.
OK. Obviously here to talk about your specialist area, care sector. Job crisis is how it's been described. The care system faces a tsunami of unmet need. What are you going to do about it?
Yeah, it's my first time on as Care Minister, so if I could just start by saying a massive, massive thank you to the 1.5 million people who work in social care. We don't say it nearly enough. They are absolutely brilliant, and I've now met not 1.5 million, but many, many people, and they just do the most amazing job and have done all the way through the pandemic. Now, as I say, it's a massive workforce. It's bigger even than the NHS, 1.5 million people. And it does have challenges all the time because every year the need grows by 1 to 2% as the demographics change in our country. More elderly people, more need. So it's this constant battle to keep enough people coming into social care. And that's one of the reasons the whole reform agenda that we put forward, and, you know, the new levy, which is going to, you know, deliver on a new social care system, is really important, because we need to professionalise this workforce. It isn't invested enough in, the training's not invested enough in. There's massive churn, 40% churn. There's way too much use of 0 hours contracts. And right now they have, you know, we've just announced this £162.5 million to help with short term between now and March, to get extra capacity in the system, extra hours, agency staff, etc. But long term, this is also a challenge that we need to put on a much better footing.
But what are you going to do in the meantime? I mean, you could look at the shortage occupation list. Currently, only senior care workers are on that list. You could change that, couldn't you?
We have senior care workers on that list, but I don't think that's really the answer, you know, hoovering up everybody else's social care.
What are you going to do? I mean,
so we've done this
100,000 short, something like that?
We've done this before. So in the pandemic, what we did before was a very similar thing to what we've announced today. So we got extra capacity in the system with agency staff, thousands of new recruits, but also more people working more hours, so quite paying for childcare in some cases, to enable people to be more flexible and work a few more hours.
So you can fix it, you don't need workers from Europe?
It's not easy to fix, because you've got 1.1 million vacancies as well in the country for staff, so I'm not saying that it's easy. It isn't easy. This money will help, but it is a challenge that we need to put this whole workforce on a much better footing for the long term.
So you're not going to change the shortage care worker list. You can fill those gaps with what we've got in the country at the moment.
Well, we did it in the pandemic. We got extra hours in.
Yes, well.
So, no, the intention is to, this money, not a penny of it's been spent today, right? We just announced it, that this is the answer to try and get more people into the workforce, more agencies, give a bit more money for that.
And just while I've got you, 11th of November, staff must be fully vaccinated to work in care homes.
Yes.
And that's going to cause another problem for you. Is that something that you might look at again?
Well, no, I mean, the reason we did that, it is a hard decision, making vaccine a condition of deployment. But, of course, the vulnerable nature of people in our residential care homes has meant that we absolutely think that this is an important thing to do. Now, the care staff have been absolutely brilliant. About 95% of them have come forward for their first dose. We're encouraging those others. Some will be exempt. There are some exemptions that can be self-certified.
But those that are not, if they don't get double vaccinated by the 11th of November, then they're out of a job.
Yes, that's. I mean, they'll be moving on to another job, I would imagine. But yes, that is the case. And I've spoken to. I was in care homes yesterday, and I was talking to local council actually about whether they felt that, you know, they would be able to manage that. By and large, there's been a massive response. People know they're dealing with the most vulnerable people. They know the vaccination makes a massive difference. We all know the winter pressures are coming. We know that there's going to be challenges. Nobody is pretending there isn't. So they have done the right thing. And, it is hard, but it's the right thing to do.
We're out of time. I must let you go. First time as Care Minister here. Hopefully it won't be the last. Thanks very much indeed for joining us.
Thank you. Thanks for having me.
Much appreciated. Thank you.